One of the primary reasons older women often feel constantly exhausted is due to the significant hormonal changes that occur during perimenopause and menopause. These life stages bring about a natural decline in reproductive hormones, primarily estrogen and progesterone, which play critical roles not only in reproductive health but also in overall energy regulation, mood, and metabolism. During perimenopause, which can begin in a woman's 40s, hormone levels fluctuate unpredictably. Estrogen levels can spike and dip erratically, while progesterone steadily declines. This imbalance can affect the body in multiple ways. For example, estrogen influences sleep quality by interacting with neurotransmitters that regulate the sleep-wake cycle. Lower estrogen levels can lead to difficulty falling asleep, staying asleep, or experiencing deep, restorative sleep. Poor sleep directly translates into chronic fatigue, making women feel drained even after a full night's rest. In addition, these hormonal shifts can trigger other physical symptoms that contribute to exhaustion. Hot flashes and night sweats are common during this period and can disrupt sleep repeatedly throughout the night. When sleep is fragmented, the body doesn't have a chance to recover fully, resulting in persistent tiredness during the day. Moreover, estrogen is involved in regulating blood sugar and metabolism. A decline in estrogen can lead to less efficient energy utilization, causing women to feel sluggish or low on energy. Mood changes, which are often linked to fluctuating hormones, can also intensify feelings of fatigue. Many women experience irritability, anxiety, or depressive symptoms during menopause. Mental and emotional strain consumes energy, further compounding physical tiredness. When fatigue is combined with mood disturbances, it can create a cycle where lack of energy worsens mental health, and mental health challenges exacerbate feelings of exhaustion. Progesterone, another key hormone, has a calming effect on the nervous system and helps regulate sleep. Its decline during menopause can result in lighter, less restorative sleep, which contributes to daytime drowsiness. Women may find themselves needing naps during the day or struggling to maintain focus and motivation for routine tasks. It's also important to note that hormonal changes don't act in isolation. They often interact with other age-related factors such as thyroid function, nutritional deficiencies, and lifestyle habits. For instance, a woman with declining estrogen levels who is also experiencing low iron or vitamin D deficiency may feel even more fatigued than from hormonal changes alone. Understanding the link between menopause, perimenopause, and fatigue is crucial. By recognizing that hormonal shifts are a natural, biologically driven cause of exhaustion, women can take proactive steps to manage their energy levels. This may include seeking medical guidance for hormone therapy, optimizing sleep routines, exercising regularly to boost energy, and maintaining a balanced diet that supports hormonal health. In summary, hormonal changes during perimenopause and menopause are a central reason older women feel chronically tired. The interplay of estrogen and progesterone with sleep, metabolism, and mood creates a perfect storm for fatigue. Awareness and targeted interventions can help women navigate this phase with more energy, vitality, and overall well-being. Another major reason older women frequently feel tired is due to thyroid imbalances, particularly hypothyroidism. The thyroid is a small gland located in the neck that produces hormones, thyroxine T4 and triiodothyronine T3, which regulate metabolism, energy production, and overall bodily functions. Even subtle disruptions in thyroid hormone levels can have a profound impact on energy levels, mood, and physical health. Hypothyroidism, or an underactive thyroid, is especially common in women over 50. As women age, their risk of thyroid disorders increases, partly due to autoimmune conditions such as Hashimoto's thyroiditis, which gradually impair the gland's ability to produce adequate hormones. When thyroid hormone levels drop, the body's metabolism slows, and cells receive less energy, leading to persistent fatigue. Women often describe this tiredness as a deep, bone-weary exhaustion that isn't relieved by rest or sleep. Thyroid imbalances can manifest in many subtle ways that make fatigue worse. Alongside exhaustion, women may experience weight gain despite no significant change in diet, dry skin, hair thinning, and cold intolerance. Brain fog, difficulty concentrating, and memory lapses are also common, making everyday tasks feel more draining. Because these symptoms can overlap with natural aging or menopausal changes, thyroid issues often go undiagnosed, leaving women struggling with unexplained tiredness for months or even years. Sleep disturbances are another consequence of thyroid imbalances. While hyperthyroidism, overactive thyroid, can cause insomnia, hypothyroidism often leads to excessive sleepiness. Even with prolonged sleep, women may wake feeling unrefreshed, contributing to a vicious cycle of fatigue. This is compounded by the fact that low thyroid function can negatively affect heart rate and circulation, reducing the efficient delivery of oxygen and nutrients to muscles and organs, further decreasing energy levels. Nutritional factors can also influence thyroid health. Adequate intake of iodine, selenium, and zinc is essential for proper thyroid hormone production. Deficiencies in these nutrients, which can become more common with age or dietary restrictions, may exacerbate thyroid dysfunction and contribute to fatigue. Additionally, interactions with medications or chronic conditions, such as autoimmune diseases, can further impair thyroid function. Importantly, thyroid-related fatigue is treatable. Diagnosis typically involves simple blood tests measuring thyroid-stimulating hormone (TSH) and thyroid hormone levels. Once identified, hypothyroidism can often be managed with hormone replacement therapy, restoring energy levels and improving overall quality of life. Lifestyle adjustments, such as maintaining a nutrient-rich diet, managing stress, and engaging in regular physical activity, can also support thyroid health and combat fatigue. In summary, thyroid imbalances are a significant but often overlooked cause of chronic exhaustion in older women. The underactive thyroid slows metabolism, affects sleep, impairs mental clarity, and reduces physical energy. Awareness, timely diagnosis, and appropriate treatment can dramatically improve energy levels, mood, and overall vitality, helping women feel more like themselves again. Sleep disturbances are a major contributor to chronic fatigue in older women. As women age, their sleep patterns naturally change, and combined with factors such as menopause, hormonal shifts, and lifestyle changes, this often leads to difficulty falling asleep, staying asleep, or achieving deep, restorative rest. When sleep quality declines, energy levels drop, mood suffers, and overall health can deteriorate, making persistent tiredness almost inevitable. One of the primary culprits is menopause and the associated hormonal fluctuations. Declining estrogen and progesterone levels can disrupt the body's natural sleep-wake cycle. Estrogen plays a key role in regulating serotonin and other neurotransmitters that help maintain sleep quality. Progesterone has a calming, sedative effect that promotes deeper sleep. When these hormones drop, women often experience lighter, more fragmented sleep, waking multiple times during the night. Night sweats and hot flashes, common during menopause, further interrupt sleep, leaving women feeling drained the next day despite spending adequate hours in bed. Insomnia, a common sleep disturbance in older women, can be caused by both physiological and psychological factors. Stress, anxiety, and depression, conditions that are more prevalent in midlife and beyond, can make it difficult to fall asleep or return to sleep after waking. Additionally, pain from conditions like arthritis or back problems can physically prevent restful sleep. Over time, this chronic lack of quality sleep accumulates, contributing to daytime fatigue, irritability, and cognitive difficulties such as brain fog or memory lapses. Restless leg syndrome (RLS) and sleep apnea are other sleep-related issues that disproportionately affect older women. RLS causes uncomfortable sensations in the legs, often accompanied by an uncontrollable urge to move them, especially at night, making it hard to stay asleep. Sleep apnea, characterized by repeated pauses in breathing during sleep, reduces oxygen supply to the body and prevents deep sleep, resulting in extreme daytime tiredness. Both conditions are frequently underdiagnosed in women because their symptoms may be less obvious than in men. Lifestyle factors also play a significant role. Excessive caffeine or alcohol intake, irregular sleep schedules, and insufficient exposure to natural daylight can all disrupt circadian rhythms, further impairing sleep quality. Similarly, excessive screen time in the evening can interfere with melatonin production, delaying sleep onset. Addressing sleep disturbances requires a multifaceted approach. Establishing a consistent bedtime routine, creating a sleep-friendly environment, and minimizing stimulants before bed can help. Medical interventions may be necessary in cases of insomnia, RLS, or sleep apnea. Hormone therapy can sometimes improve sleep quality in postmenopausal women, while cognitive behavioral therapy for insomnia, CBTI, has proven effective in managing chronic sleep difficulties. In summary, sleep disturbances are a major factor behind chronic fatigue in older women. Hormonal changes, menopause symptoms, stress, medical conditions, and lifestyle habits all contribute to poor sleep quality. By identifying the root causes and implementing targeted strategies, women can restore more restful sleep, significantly boost energy levels, and improve overall well-being. Nutritional deficiencies are a key reason why many older women feel constantly fatigued. As the body ages, its ability to absorb and utilize nutrients efficiently declines, making deficiencies more common. Insufficient intake or absorption of critical nutrients such as iron, vitamin B12, and vitamin D can have a profound impact on energy levels, cognitive function, and overall health. Iron deficiency is one of the most widespread nutritional issues among older women. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen to the body's tissues. Without enough iron, the body struggles to transport oxygen efficiently, leading to fatigue, weakness, shortness of breath, and difficulty concentrating. Iron deficiency anemia, in particular, can make even simple daily tasks feel exhausting. Older women may be at higher risk due to factors like reduced dietary intake, blood loss from medical conditions or medications, and decreased absorption of iron from the digestive system. Vitamin B12 is another nutrient critical for energy production and neurological function. B12 helps form red blood cells, supports nerve health, and plays a key role in converting food into usable energy. A deficiency in vitamin B12 can lead to anemia, neuropathy, and persistent fatigue. Older adults are particularly susceptible because stomach acid levels, which are necessary for B12 absorption, tend to decline with age. Dietary sources like meat, fish, and dairy may not be sufficient if absorption is impaired, and deficiencies can develop gradually, often going unnoticed until fatigue becomes severe. Vitamin D deficiency is also common in older women and can significantly affect energy levels. Vitamin D is crucial for bone health, immune function, and muscle strength. Low vitamin D levels are associated with muscle weakness, increased risk of falls, and generalized fatigue. Limited sun exposure, reduced dietary intake, and decreased skin synthesis of vitamin D with age all contribute to the risk of deficiency. Since vitamin D is fat-soluble, it is stored in the body, but prolonged deficiency can slowly sap energy and lead to a feeling of constant tiredness. Other nutrients, such as magnesium, calcium, and omega-3 fatty acids, also play roles in energy metabolism, muscle function, and brain health. A lack of these nutrients can exacerbate fatigue, reduce physical stamina, and impair mental clarity. For example, magnesium is essential for over 300 enzymatic reactions in the body, many of which are involved in energy production. Deficiency can result in muscle cramps, irritability, and low energy. Addressing these deficiencies requires both dietary adjustments and, in many cases, supplementation. Consuming iron-rich foods such as lean meats, legumes, and leafy greens, along with foods fortified with B12 and vitamin D, can help. In some cases, oral supplements or injections may be necessary, especially for vitamin B12, to restore optimal levels. Regular blood tests can help monitor nutrient levels and guide appropriate interventions. In summary, nutritional deficiencies are a silent but significant cause of fatigue in older women. Iron, vitamin B12, and vitamin D are particularly critical for maintaining energy, muscle function, and overall vitality. Recognizing and correcting these deficiencies through diet, supplementation, and medical guidance can dramatically improve energy levels, mental clarity, and quality of life, helping women feel more vibrant and less chronically exhausted. Chronic stress and mental fatigue are major contributors to persistent exhaustion in older women. While physical health issues like hormonal changes or nutritional deficiencies are often highlighted, the mental and emotional strain that accumulates over decades can be just as draining, if not more so. Chronic stress affects nearly every system in the body, disrupting sleep, hormone balance, and energy metabolism, leading to a pervasive sense of fatigue that feels impossible to shake. Stress triggers the body's fight-or-flight response, activating the release of stress hormones like cortisol and adrenaline. In short bursts, this response is adaptive and helpful, allowing the body to respond to immediate challenges. However, when stress becomes chronic, cortisol levels remain elevated for prolonged periods, which can negatively impact multiple bodily functions. High cortisol interferes with sleep quality, weakens the immune system, disrupts digestion, and can even contribute to weight gain, particularly around the abdomen. Each of these effects drains energy reserves, leaving older women feeling perpetually tired. Mental fatigue compounds the problem. Over decades, women often juggle multiple responsibilities, caring for family, managing finances, maintaining social relationships, and sometimes continuing professional work well into later life. This constant cognitive load can wear down the brain, leading to difficulties with concentration, memory lapses, and a sense of mental fog. When the mind is exhausted, physical energy also diminishes because mental and physical fatigue are closely linked. Tasks that once felt easy can become overwhelming, and motivation drops, creating a vicious cycle of stress and tiredness. Emotional stress, such as anxiety, depression, or grief, also plays a significant role. Older women may face life transitions like retirement, the loss of loved ones, or health challenges, all of which can intensify emotional strain. Anxiety increases heart rate and cortisol production, while depression often reduces motivation and disrupts sleep, both of which drain energy further. Even low-level, chronic emotional stress can significantly impact overall vitality if left unmanaged. Lifestyle factors often exacerbate the effects of chronic stress. Lack of physical activity, irregular sleep schedules, poor diet, and social isolation can magnify fatigue and reduce resilience to stress. For example, regular exercise is known to improve energy levels, reduce cortisol, and boost mood, but many older women may struggle to maintain consistent activity due to physical limitations or lack of motivation. Similarly, a diet lacking in essential nutrients can make the body more vulnerable to stress-related fatigue. Addressing chronic stress and mental fatigue requires a multifaceted approach. Mind-body practices such as yoga, meditation, and deep breathing exercises can lower cortisol levels and improve relaxation. Regular physical activity, even gentle walking, strengthens both body and mind, enhancing resilience to stress. Maintaining social connections and seeking support through friends, family, or professional counseling can alleviate emotional burden. Finally, establishing routines that prioritize sleep, nutrition, and self-care can help restore both mental clarity and physical energy. In summary, chronic stress and mental fatigue are silent but powerful drivers of persistent tiredness in older women. Prolonged activation of the stress response, emotional strain, cognitive overload, and lifestyle factors all contribute to a state of exhaustion that impacts daily life. By recognizing these stressors and implementing targeted strategies to manage them, women can regain energy, improve mental clarity, and restore a sense of balance and vitality. Another significant factor contributing to chronic fatigue in older women is the side effects of medications. As women age, they often take multiple prescriptions for various health conditions, including high blood pressure, diabetes, arthritis, thyroid disorders, or mental health concerns. While these medications are essential for managing chronic illnesses, they can inadvertently cause tiredness, drowsiness, or lethargy, which significantly impacts daily energy levels. Polypharmacy, the use of multiple medications simultaneously, is particularly common among older women. While each medication may be necessary individually, the combined effect of multiple drugs can amplify fatigue. For instance, blood pressure medications such as beta blockers or diuretics can lower heart rate or alter electrolyte balance, leading to weakness, lightheadedness, or reduced stamina. Similarly, sedatives, sleep aids, or anti-anxiety medications can leave women feeling groggy during the day, even if they improve sleep at night. Pain medications, especially opioids, are another common contributor to daytime fatigue. While they effectively manage chronic pain from conditions like arthritis or back problems, opioids can slow the central nervous system, causing drowsiness and reduced mental alertness. Even non-opioid pain relievers, such as certain anti-inflammatories, can lead to gastrointestinal discomfort or disrupt sleep, indirectly contributing to fatigue. Medications for mental health, such as antidepressants or anti-anxiety drugs, can also have sedative side effects. Selective serotonin reuptake inhibitors, SSRIs, tricyclic antidepressants, and benzodiazepines, though effective in treating depression or anxiety, may cause low energy, mental fog, or lethargy in some individuals. Older women may be more sensitive to these effects because metabolic changes with age can slow drug clearance, leading to higher concentrations in the bloodstream. Hormonal medications, such as those used for thyroid replacement or menopause symptom management, can also impact energy if doses are not optimized. For example, an underdosed thyroid medication may fail to resolve fatigue caused by hypothyroidism, while an overdosed regimen may cause restlessness and insomnia, both contributing to exhaustion. It's also important to recognize that some medications interact with each other, intensifying side effects like fatigue. For instance, combining certain blood pressure medications with sedatives or pain relievers may lead to excessive drowsiness, dizziness, or even fainting. Older women are particularly vulnerable to these interactions because age-related changes in liver and kidney function can slow the metabolism and excretion of medications. Addressing medication-related fatigue requires careful review with a healthcare provider. Keeping an updated list of all medications, including over-the-counter supplements, allows doctors to identify potential culprits and adjust dosages or switch to alternatives with fewer sedative effects. Timing of medication can also make a difference. For instance, taking sedating drugs in the evening may reduce daytime drowsiness. In summary, medications are a double-edged sword for older women. While essential for managing chronic conditions, they can contribute significantly to fatigue. Polypharmacy, side effects from pain relief, sedatives, hormone therapies, and drug interactions all play a role in reducing energy levels. Awareness and proactive management through consultation with healthcare providers can help minimize these effects, allowing women to maintain higher energy levels and improved quality of life. Underlying health conditions are a major contributor to persistent fatigue in older women. Even with adequate sleep, balanced nutrition, and healthy habits, chronic medical issues can drain energy, making women feel constantly tired. Among the most common culprits are anemia, diabetes, and heart problems, each of which affects the body's ability to produce and sustain energy in different ways. Anemia, particularly iron deficiency anemia, is prevalent in older women. Iron is crucial for producing hemoglobin, the protein responsible for transporting oxygen to tissues and organs. When iron levels are low, the body struggles to deliver adequate oxygen, leading to fatigue, weakness, dizziness, and difficulty concentrating. Chronic blood loss, often from gastrointestinal issues or heavy periods earlier in life, and poor dietary intake can contribute to anemia. Fatigue from anemia is often described as deep, persistent exhaustion that is not relieved by rest, making even simple daily tasks feel overwhelming. Diabetes is another health condition closely linked to fatigue. Both type 2 diabetes and poorly managed blood sugar levels can interfere with energy metabolism. When blood sugar is too high, the body cannot efficiently convert glucose into usable energy, leaving cells starved and causing tiredness. Conversely, episodes of low blood sugar can produce dizziness, weakness, and mental fog. Diabetes also increases the risk of sleep disturbances, nerve damage, and cardiovascular complications, all of which further contribute to chronic fatigue. Many older women may experience fatigue as one of the earliest, yet often overlooked, symptoms of diabetes. Heart problems, such as heart disease, arrhythmias, or congestive heart failure, can significantly reduce energy levels. The heart's ability to pump blood efficiently diminishes with age or due to medical conditions, limiting oxygen and nutrient delivery to muscles and vital organs. This reduced circulation results in weakness, shortness of breath, and persistent tiredness. Women may notice that even light physical activity feels exhausting, and recovery times are longer than before. Additionally, heart-related medications, while necessary, can sometimes amplify fatigue, creating a cycle of exhaustion that affects daily life. Other chronic conditions, including kidney disease, liver issues, and autoimmune disorders, can also sap energy over time. Chronic inflammation, impaired organ function, and the body's ongoing efforts to combat disease all require energy, leaving women feeling drained. Conditions like arthritis may not only cause pain but also disrupt sleep, adding another layer to fatigue. Early detection and management of these underlying conditions are crucial for improving energy levels. Regular medical checkups, blood tests, and screenings can help identify anemia, diabetes, or heart problems before they become severe. Treatment plans may include medications, lifestyle changes, dietary adjustments, or specialized therapies, all aimed at addressing the root cause of fatigue. In summary, underlying health conditions such as anemia, diabetes, and heart disease are major drivers of chronic tiredness in older women. These illnesses affect oxygen delivery, blood sugar regulation, and circulation, creating persistent exhaustion that impacts daily life. Recognizing these conditions early, seeking proper medical care, and managing them effectively can significantly restore energy, improve well-being, and enhance quality of life for older women. A sedentary lifestyle and lack of regular physical activity are major contributors to chronic fatigue in older women. As people age, daily routines often become less active, and physical activity may be limited due to health concerns, joint pain, or simple habit. However, a lack of movement has a profound impact on energy levels, muscle strength, cardiovascular health, and overall vitality, often creating a cycle of exhaustion that is difficult to break. Physical activity plays a key role in maintaining energy because it stimulates circulation, boosts metabolism, and strengthens the cardiovascular system. When the body is inactive, circulation slows, muscles weaken, and oxygen delivery to tissues decreases, making even light physical tasks feel tiring. Regular movement also enhances mitochondrial function, the energy powerhouses in cells, so a sedentary lifestyle reduces the body's ability to generate energy efficiently, leaving women feeling lethargic and unmotivated. Exercise also has a direct impact on mood and mental energy. Physical activity triggers the release of endorphins and neurotransmitters such as serotonin and dopamine, which improve mood and reduce stress. A sedentary lifestyle, in contrast, can contribute to feelings of depression or anxiety, both of which exacerbate fatigue. Mental fatigue and emotional stress often accompany physical inactivity, creating a feedback loop where low energy discourages movement, and lack of movement worsens fatigue and mood. Muscle atrophy, or loss of muscle mass, is another consequence of a sedentary lifestyle, especially in older women. Age-related sarcopenia, combined with inactivity, reduces strength and endurance, making daily activities like climbing stairs, carrying groceries, or even walking short distances more exhausting. This physical strain contributes to feelings of fatigue and can lead to a greater risk of falls or injuries, further discouraging activity and reinforcing the cycle of inactivity and tiredness. Moreover, a sedentary lifestyle negatively affects cardiovascular and metabolic health. Physical inactivity increases the risk of obesity, type 2 diabetes, high blood pressure, and heart disease, all of which are associated with fatigue. Exercise helps regulate blood sugar, improve heart function, and maintain healthy weight, all of which support sustained energy levels. Without movement, older women are more likely to experience sluggishness, reduced stamina, and persistent tiredness throughout the day. Breaking free from a sedentary routine does not require intense workouts. Even moderate, consistent activity such as walking, stretching, yoga, swimming, or light resistance training can dramatically improve energy levels, mood, and overall well-being. Incorporating movement into daily life, taking stairs, gardening, or engaging in short exercise sessions, enhances circulation, strengthens muscles, and improves metabolic efficiency. Over time, these small changes can reverse the fatigue associated with inactivity. In summary, a sedentary lifestyle and lack of physical activity are powerful contributors to chronic fatigue in older women. Reduced circulation, weakened muscles, poor cardiovascular function, and low energy production combine to make daily life exhausting. Incorporating regular movement, even in moderate amounts, helps boost energy, improve mood, and restore vitality, breaking the cycle of tiredness and enabling women to live more active, fulfilling lives.